children who are entering foster care, whether they're very young children or school-age children or older children, have all experienced some kind of trauma. And by that I don't mean necessarily physical trauma. They've experienced social emotional trauma for certain. They're being removed from everything that they know. There's been chaos in their lives in some way or another. So these are children that the American Academy of Pediatrics describes as children with special health care needs. Kids in foster care in particular are at risk for social emotional issues, they're at risk for developmental issues, and because of the chaos that they may be coming from, they very often have not had consistent medical health care or dental health care.
The foster care population in our state is governed by the Division of Social Services. However, all 100 counties within the state of North Carolina provides the mandated service of foster care. On average, there are around 9,000 youth that are in foster care in the state of North Carolina. With that being said, we know that the age range for youth that are in care is from birth up until the age of 18. In North Carolina, we also provide the opportunity for our youth to extend their services of support from the age of 18 to 21 by signing a CARS agreement. In addition to, on average, 9,000 youth being in foster care in the state of North Carolina, there are also kinship care arrangements. And so there is a number of youth that are receiving care by either kin or relatives. And so we have to make sure that when we talk about safety and well-being and permanence, that we also factor in the kinship arrangements for our youth. To be in the custody of a local county Department of Social Services means that that local county has responsibility to provide care for an individual that's in foster care by making sure that their safety, well-being, and permanency needs are met. DSS responsibilities in reference to medical needs for youth in foster care is comprehensive. What we do know is that whenever children enter foster care, they have been exposed to matters of compound stress, abuse, and also neglect. And if they suffer from any of those factors, what we know is that they come in with a possible disadvantage in reference to having routine care and also continuous follow-up in reference to what their needs are. From the DSS perspective, the health summary forms serves as a gateway or a portal of information that should be used for the child's best interest. What we know is that communication is important. And as we start to provide services for a youth that is in care, we want to make sure that we engage the family and also any existing medical providers in understanding that there is a need for comprehensive information. We want to make sure as a local county that no balls are dropped in reference to ensuring that the medical needs are met. And so the health status form is critical in providing opportunity for us to outline in detail what information is essential around medical care.
The health summary forms for children in foster care have been developed through the work of the North Carolina Pediatric Society and the Fostering Health North Carolina Project. So in the Academy's schedule, the initial visit is intended to be a brief visit where a provider is introduced to a child. And on the initial form, DSS, to the best of their ability, completes a lot of background information. So when the child comes in, the provider at least has a synopsis of what has happened and why the child is coming into care. They do a brief assessment and then make sure that any medications the child needs are refilled and that any durable medical equipment is assured for their new placement. The comprehensive visit is just what it says. It's a comprehensive physical with particular attention to development and social emotional needs. And after that visit, that form is completed and includes recommendations for any further follow-up or referrals or new treatments. And that form is shared with both DSS and the care manager at CCNC. It has particular importance in that it's a synopsis of that child's history and their current needs. And then finally, there's a well-visit form, again, a one-pager for the provider to fill out after these enhanced schedule visits. to send to DSS and to the care manager so that if there are any updates or changes to medications, everyone has that information. So the hope is that these forms make it easy for people to remember everything that needs to happen at the visit, do it in an organized way, and have consistency around the state in how we do that.